Welcome back to Against the Grain, everyone. I'm your host, Anthony, joined as always behind the cameras by Sarah, who we'll hear a lot more from today, I'm sure. And today we are always honoured to have any guest on, but today particularly is a privilege and an honour to have Dr. Michael Azzi on the show with us. Thanks for coming.
It's great to be here.
Thank you. We for anyone who's, probably saw in the title already if you're pressing onto this podcast, but we had Michael Jaksic, Jaksic, however you want to pronounce it, on the podcast, and he was telling his extremely powerful testimony, and he mentioned that he and his wife struggled to fall pregnant, I believe, for 9 years it was, the 9 years they were married, and he started to see. He mentioned a NaPro doctor. And that was the first time that I had heard of a NaPro doctor. And I think for a lot of people, it was the same. And so that initially got me curious. But then we were speaking about it earlier. You were gracious enough to reach out and let us know that if we wanted to have a chat about it, that we could, which I really appreciate, because I thought that would be awesome. A lot easier for me personally to have a chat with you and learn about what it is and things like that than to go and read about it. It's just not my thing. So again, thank you so much for coming on.
No, thanks for having me, and yeah, very happy to have a chat.
Awesome. I should have probably asked this before the episode, but I'm going to refer to you as doctor. Is that okay?
Honestly, Michael's fine.
Are you sure? Yeah. Just Michael? Yeah. Okay. Because you've earned the title, I thought.
We're not in a clinical situation, so I really don't mind Michael.
Fair. We'll go with Michael then. Thank you. And what I thought would be good is, just before we get into the whole conversation about, the what NaPro is and things like that, and go into detail, I thought it'd be good to just get to know a little bit about you, who you are, family life, things like that.
Yeah. Essentially, I'm a GP who's specialised in NaPro technology. My background is that married of 6 years, Maronite Catholic, have 3 children, one just a month ago. And then we also have, one that we praise with our Lord along the way. And essentially, I guess I'm just always looked for a way to, live out my job and my career as a vocation. And so that's kind of led me down the path into what I'm doing today. Yeah.
Beautiful. It's beautiful to hear you mention, that the one child that, please God, is with our Lord, because I think that's becoming I think we're becoming more aware in the church, at least, that they're still very much like our children.
Definitely.
And so I say our. I was like, I can't say our because I don't have kids. But I was like, but yeah, they are, and it's a beautiful thing to hear you say. I think we'll just, if you don't mind, we'll jump straight into kind of where you started, how you got into the NaPro sort of side of GP. Is it a form of GP? Sorry, this is.
It wouldn't be recognised here in Australia. So in Australia, I'm still registered as a specialist GP.
Oh, okay.
Yeah, but I kind of have a specialised practice. So how some GPs would go into working, only skin cancer specialists or that type of thing.
I see. Yeah. Okay.
Yeah.
Okay.
So registered with in Australia as a GP.
Awesome.
Yeah,
Awesome.
But, moving very much into the NaPro side of things, exclusively, God willing, if things go well.
Beautiful. Yeah. Beautiful. All right. Sorry in advance to you and to our listeners. You're about to know how little I know about the medical field.
Happy to fill you in on it.
And so, yeah, I appreciate you doing that. So then what made you interested in the whole NaPro side of it?
I guess the interest in NaPro it first started on my radar very early on, maybe even about 15 years ago when I was still a medical student. I first heard of NaPro technology, and piqued my interest and wanted to know more about it. But then really, I guess it's my journey as a GP and through that training that led me into wanting to do the NaPro training itself and get further into it. Yeah.
Okay. So you were already studying medicine before you even knew about NaPro. So you always wanted to become a doctor?
Pretty much. Yeah.
Oh, beautiful.
Yeah.
Why is that?
I don't know. I just thought that it's always something that I wanted to do. I couldn't give you like a reason. I guess growing up, my dad struggled a lot with his eyes and having corneal transplants and seeing doctors and specialists. So that was one of my kind of very first ambitions, was to become an ophthalmologist. But yeah, God led me in a different direction. And getting through medical school and then into specialty training, went into a different direction, and ended up as a GP around the time that I was getting married and looking to start a family. And I had been doing a lot of hospital work and shift work and surgical work, but it wasn't a very good lifestyle for that sort of thing. Lots of hours and weekends and sleeping in the hospital and things like that. So that's why I settled on GP. But then that in itself has been an amazing journey. Yeah.
Awesome. How good. So, before we even continue about this whole thing, what is NaPro?
Yeah, so NaPro stands for Natural Procreative. The full name is NaPro Technology. So essentially, it's a field of medicine. We call it restorative reproductive medicine, and the aim is really just that to restore reproductive health. So it doesn't just deal with fertility issues; it deals with general women's and men's health issues. And I guess as a bonus, you work on people's fertility, because a lot of fertility issues you can just improve by restoring people to their normal health. We see fertility more as a symptom of something going on deeper and something going on behind the scenes. The body screaming at us that I'm not healthy enough to carry a baby, or that type of thing. So for us, it's more of a symptom. It's not, I guess, the view that fertility is a label or a diagnosis or something you have to get around, which is what a lot of methods these days are trying to use.
Wow. Okay. So infertility, I suppose, isn't necessarily the issue. It's just a symptom of a deeper issue, is what you're saying.
Yeah.
Oh, wow.
Yeah.
Okay. This is already striking me.
Yeah. So infertility is, it's also a fluid thing. It's not just something that, say you'd have for life as a diagnosis of a medical condition. You can go through fertile times and you can go through infertile times. And that's why really it is a symptom of, the body's health.
Oh, wow. Okay. So, I mean, I would imagine I know that there have been cases where some people think that, they haven't gotten pregnant in, the first year of their marriage or something.
Mm-hmm.
And they, believe there's an issue or something like that. Is it always the case that there's just something they can fix, or is it just sometimes it just takes a bit more time? Does that make sense?
It does.
Yeah.
It's a little bit of both, and we work on both sides of things. Okay. I would say it's extremely rare that we deal with conditions where a couple are truly permanently infertile. That would be something like, primary ovarian failure, which means that, the woman is not producing any eggs, or, maybe even never went through puberty and never started producing eggs with certain conditions. Similar thing for the male, if it's something like azoospermia, where they're not producing any sperm, that would be, and then there's certain conditions, whether they're hormonal or genetic, that can lead to that. But what I'm trying to say is, essentially, if you don't have any sperm or any eggs, they're kind of the very rare circumstances we can't help. Anything else, there's always a bit of a chance, because all you need is one sperm and one egg for conception.
Wow. Yeah. So it sounds, I don't know, I hope this comes out right, but it sounds like, because you hear of all these different technologies and treatments and things that are like, they seem so complex and things like that. This kind of already to me sounds like really simplistic almost.
Yeah. Yeah.
Is
I
that-
love that you said that, because sometimes when I'm sitting with my patients and I'm explaining to them, you know, that's what they're saying to me and that's what I'm saying to them. I'm just doing basic medicine, you know, looking at root causes like we're taught to do. We can get into the real, you know, detailed nitty-gritty side of things with ovulation and sperm production and things like that. But when you explain it, it really is just basic medicine, going back to root causes and dealing with and treating with them. Yeah, wow. So I'm glad you said that.
Yeah, that's good. Well, you made it clear in your in your description of it. But that's yeah, it's just really interesting to hear that. I suppose we've become so dependent on like, I guess on like, not manufactured, but I don't know what I'm trying to think of, but like, you know, just the medicines that we usually take and all that stuff. And
we'd say either more like artificial or synthetic.
Artificial, that's the word. Thank you.
Yeah. And so the methods that, you know, are outside of NaPro are like things like IVF and the assisted methods. We call them artificial reproductive technologies.
Oh, okay.
Yeah.
Well, that yes.
might be what you're referring to.
That is exactly, what I'm referring to. And artificial is exactly the word I was looking for too. Yeah. But yeah, we're so used to those artificial means that that I think that's probably a large reason why it sounds so simplistic, like this NaPro. But then also, you're just giving natural remedies, I guess, which in a way I think is kind of confronting for someone to hear, that it's not just that you have to, you know, take this medicine or do this extra thing to fix. It's like you actually have to change something you're doing.
Yes.
Which probably is a bit tougher. Have you had that experience?
Yeah. There's a lot of lifestyle changes involved, definitely. But there would also be some medicines that we use. Definitely we can get into the medical side of things, but our aim with that side of things is we always work with the body. We never aim to kind of overtake the body's processes. It's always, you know, some form of assistance, say with the female's natural cycle, or some form of assistance to help with the male with, you know, sperm health and sperm production and things like that.
Can I ask, I mean, I was probably going to ask this later, but since it's been mentioned, I was having a chat with a friend yesterday, and shout out, you'll know who you are. But she asked a really good question, and I thought perfect timing because we have you coming on the podcast today. And she asked, so, you know, like how you do like I don't know how to say it properly, like fertility testing, I guess. Are there immoral ways to do it and moral ways to do it, like within the bounds of the Catholic Church, I guess?
Yeah. So when we're talking about testing and investigations, yes, but then also there's moral and immoral treatments as well. Yeah. I guess with the testing and investigations, the main thing we focus on is the male and how we collect sperm from the male. Because with the women, essentially, you know, doesn't require an act of intercourse to, you know, collect information from her about, you know, her cycle and her egg quality and, you know, ovulation, things like that. For a male, it does. It's really the only way we release sperm, you know, apart from, say, very painful procedures where they harvest sperm from the testicles.
Wow.
Yeah, so essentially, you know, if we're talking about an immoral way to do that, the normal way that a doctor would request a sperm or semen analysis to check on the sperm is, you know, a male would sit in a lab, you know, an act of, forgive me being crude, but an act of masturbation to collect the sperm, essentially. The moral way that we encourage to do that lies within marriage and within the act of intercourse. So essentially, every act of intercourse needs to be open to life and cannot be, I guess, contraceptive in nature. So we have to collect it within those bounds. And the way we do that is using, we call it a sheath, but it's essentially a condom that doesn't have any lubricants or spermicides or anything that's going to impact sperm quality or kill off sperm. and you have to put holes in them because these sperm collection condoms are not open to life. They're essentially going to stop the sperm passing through to the female. So we get our patients to put a few holes in them, and that way, there is a possibility of sperm passing through, and that openness to life still occurs within that act. But then the majority of the semen and the sperm remains in the collection condom, and that's how it's collected, within an act of intercourse.
Wow.
What the? This is
I say to
insane.
my patients that it's actually really difficult logistically. Nothing is really easy for us Catholics, especially if we want to live out our faith day to day. So there's a bit of like logistical issues with that. Usually when you're doing a semen analysis, you have to get it under a microscope in a lab within an hour. That's why they get you to do the sperm collection in the lab itself. Whereas for my couples, it has to be done, say, during business hours. They have to be fairly close to a lab, sometimes a 20, 30-minute drive to get there. They have to let them know that they're coming, that way that it can be analysed within, the appropriate time frame. So it's not an easy endeavour, but it can be done morally.
Wow.
Sorry,
really
I just have a question. So is it moral because there's still the potential with the holes in it that
Correct.
something can go through, but you still expect that things aren't going to go through, but there's still potential that it can?
Yeah, the majority of the
Okay,
sperm remains in the condom for collection, but the act itself, there's still that possibility of conception occurring because like I said, you only need one sperm and one egg.
Yeah.
Goodness. Yeah.
Wow. That's so interesting. Sometimes it is a greater effort to be Catholic.
Yeah.
And sometimes maybe is a bit of an understatement, but I always say, like, God forbid we put a little bit of effort into our faith.
Yeah.
So wow, okay, that's really interesting. That's honestly not what I was expecting.
No.
So, but that's really good to know. And so, for someone who's like, who's trying to get like a semen test done or something like that, I hope I'm using the right word. Sorry,
That's fine.
but is it necessary then that they see a NaPro doctor, for example, or like what? Yeah, where do they go to
Not
get that
always.
testing done?
No, I mean you could do you could do a semen analysis with a regular GP or with other fertility specialists. They're the ones that a lot of times when I see patients, they've already had semen analysis done by other fertility specialists, IVF specialists, things like that.
But immorally?
Well, it would depend on the couple whether they're aware that there's a moral way to collect it. But I've certainly seen some couples who've done it morally because obviously they're into their faith and they know about these issues, so they do their own research. They find the special condoms themselves, and they do the
Wow. So I hadn't even thought about that, to be honest. Like until that friend asked that question, and I thought like that's not even something I ever like, not even for a second popped into my mind.
Yeah.
And so I'm sure a lot of like our listeners now probably haven't thought about that, but at least I hope I'm not the only one. But these things are really good to know, at least, like to be made aware of, so that we, even if it's a different sort of situation or a different scenario or whatever, then we can actually think, hey, there might be a moral and immoral way to do this, which is just pretty cool.
Yeah. So then I've received the question in the past, how is it done, say, for a young male who's not married,
Oh, yes. That's a great question.
My answer would be, that's a little bit tougher. Obviously, we wouldn't encourage the act of collecting semen on your own.
Yep.
But I guess my answer to that is usually we can do other things and find out what are the factors that could be impacting your sperm, whether we're doing it, because you might have a certain genetic condition, whether we're doing, why do we need to do the test in the first place? Are we doing it because you have a known hormone imbalance? You could be impacting your testosterone. You might have had previous trauma to that area in the past, and it could be impacting your sperm quality. So what I would do is dig into the factors behind it, do other things like blood tests and ultrasounds, and that can give us a bit of a picture or an idea of what's going on in the background, because I would want to be doing that anyway, not just the semen analysis. But the semen analysis itself, I would usually say, it has to wait until it matters, when you are going to be having kids and in a marriage, essentially.
Yeah, that's fair. It does seem, maybe a little bit. I might sound a little bit ignorant or just slack, but it does seem like maybe a bit premature to be doing it before marriage, or to be maybe that concerned or something like that before marriage, because you don't, or for a Catholic at least, who doesn't have sex before marriage. It does seem like a bit premature to be wanting to test that. Do you, I mean, like, I know that, let me start that again. So I was doing a bit of research on your website and things like that. And I saw like the success rate. Obviously, you know, there are considerations and things like that, but it's a pretty high success rate of pregnancy within the first year of NaPro treatment. And it was, I believe, 70 to 80%.
Depending on the condition, but somewhere between 60 to 80%.
Oh, beautiful.
Yeah.
Still a great, great success rate. Yeah. Do you sort of find that, maybe I kind of asked this already, but I kind of want to push on it just to try and understand a bit more, but do you find that a lot of these things are just simply lifestyle? Sorry, I feel like I might be getting you to repeat yourself, but
no, we touched on it earlier. I think,
is it more so like lifestyle changes, or is it just time, or is it again both? Like with that kind of high success rate.
Yeah.
The reason I ask that is because I think like maybe it's something as simple as just fixing your diet.
Yeah.
And then you could be you could be okay.
Yeah.
But then there's also the consideration, well, what if I had just waited? Yeah. What if I didn't go and it still happened, within that year or something like that? Does that make sense?
It does, yeah. There's a whole range, I would say. And that's why our approach is more holistic. And the NaPro approach, if we want to get into the history of it a little bit later, it's essentially built upon an NFP method, natural family planning method. So, that's a woman tracking her cycle, looking for fertile signs, what we call biomarkers, so signs of the body of what's going on in the background with ovulation and her cycle. And so NFP methods really focused on, finding what are the fertile times and what are the infertile times of the cycle, whether a couple, is looking to have better timing and looking to fall pregnant can help, or if they have reasons, serious grave reasons where they can't fall pregnant, they can use those methods, in a moral way to avoid pregnancy if they need to. So they avoid intercourse at those fertile times. So the NaPro approach is really a medical application of, one of those NFP methods. And it's, when you mention timing, that's one of the main things we do is, looking at tracking women's cycles and getting them to understand their cycles. So sometimes it is just an issue of timing itself. But then, you build on top of that and you dig in a little bit deeper. And, our assessment, my initial assessment takes at minimum an hour, sometimes an hour and a half, because I go into all the medical details, but also all the lifestyle things you spoke about. Sometimes it can be just as simple as, fixing, certain issues like, adding in some exercise every day to increase your beta endorphin levels, which are amazing for fertility, or, fixing your diet, making it not so inflammatory, with your refined sugars and synthetic oils and things like that. Maybe it can just be, a factor of, your sleep is something going wrong with your sleep and you're not having enough rejuvenation at night, you're not having a good quality sleep, and that's certainly going to impact your functions during the day. So really when I say that fertility is a sign of your overall health and something going on, it could be anything really in your health that's impacting your fertility. Wow. The way I look at it is, this might be getting a bit abstract or philosophical, but it's kind of a sign of the body's overall health in that if your body's not healthy, it's going to turn a little bit selfish. The first function it's going to shut down is that outward function of kind of fertility. It's going to say, okay, let's turn in on ourselves and try and focus on what's going wrong.
Wow.
Yeah, and then on top of that, so I mentioned diet, exercise, sleep, mental health is a big one for me. And how the stress and anxiety of, our modern day lives can impact our bodily functions, but also with some of the couples I see, the stress and anxiety of the struggles they've been through with fertility and recurrent miscarriage, and the pressures, the outside pressures from extended family and other people, and having kids these days. So all of that is a big factor for me. And then again, you can build on top of that and then getting deeper into the medical details of it. So I try and cover all my bases essentially. Yeah. And
Wow.
the way I explain it to my patients is it's probably more of a scale when we look at fertility. So you could be more on the infertile side of things here. And every little thing we fix or we optimize, whether we work on your diet, we work on your weight, we work on, your sleep, and then we work on the medical issues as well, ovulation, male sperm parameters for the man, all that type of stuff. We're moving you closer and closer and closer to the fertile side. We don't know, where do you have to cross over, essentially. So that's why we work on everything.
Wow.
Yeah.
I love that. I love that you said, sorry, did you?
Okay.
I love that. Yeah, you mentioned the holistic approach, because it's, firstly, that's so much for you to to try and figure out.
Yeah.
But it's amazing that you go through all of that and obviously again try and find like the treatment, the remedies for those things. In terms of that holistic approach, like you touched on, the mental struggle and emotional toll that infertility or miscarriages and things can have on a couple or an individual. How do you go about like supporting them through that mental and emotional sort of toll?
Yeah, I think a lot of it is number one, kind of validation of the journey that they've been through, but also providing the whole process of providing them with answers and providing them with hope can be a big thing. But also we want proper appropriate mental health support. So I very regularly refer to a psychologist, someone who can work with people and help them process these past issues as well. Yeah.
Awesome. Do you find like that most patients that come in, are most of them Catholic, or do they vary? Or Christian even?
That's a good question.
Yeah.
I would say majority that I've seen are Catholic, but we do have other non-Catholic Christians, and I've seen a couple of secular couples who are just searching for answers, really. Yeah, but the majority, maybe 80 to 90%, would be Catholic.
Because it seems like, again, like I had no idea about this, but it seems like most of the people that are aware of NaPro are Catholic.
Yeah.
And maybe that's because you touched on earlier. I can't remember if it was on the podcast or not, but you mentioned the like the origin of NaPro.
Yeah.
I don't know if that might have something to do with it, but that might be cool to just go into, just to understand where that's sort of come from.
Yeah.
That's all right.
Yeah, of course. So NaPro technology was developed essentially by one doctor, one gynecologist, and a team around him, but he was probably the main doctor. His name's Dr. Thomas Hilgers in the United States. And it was really as a response to the encyclical Humanae Vitae. So I think getting into the background of Humanae Vitae as a starting point, and then moving forward to how NaPro was developed would be good. Do you know much about Humanae Vitae itself? And
Not overly.
okay.
Not overly.
So I guess a bit of like historical context around the time of Humanae Vitae. It was released in 1968. And at that time, the oral contraceptive pill had just been invented or developed in early 1960s. So there was a lot of debate and discussion in the church and among theologians about whether the church would accept contraception. And there was a few years earlier there was a Lambert conference, which is a big Anglican conference similar to our councils, and they had decided to accept contraception. And so a lot of, I guess, the common thought around the time, the popular thought, even among theologians, they were making arguments for, yes, contraception was going to be allowed within the church.
Oh, wow.
And so Pope Paul VI, now Saint Paul VI, released this encyclical called Humane Vitae, of human life. And in it, I guess as we saw encyclicals before, it wasn't really new teaching, but he kind of went through the teaching of the church over time on marriage and the sexual act, and he kind of developed and built upon that. And it's this really amazing document. I encourage every Catholic should read it, but especially married couples and people going in towards marriage. I think it's really important for them to read. It's not that long. I have a little booklet at home. It's about 40 pages. 20 of those are like the references and intro and things like that. So you could get through it in one sitting or in one night, essentially. But what Humane Vitae is it talked about the fabric of marriage, essentially, what it means theologically, and it was a little bit of a basis of when Saint John Paul II went on to expand about that, in theology of the body and how our bodies show us God, our Creator. And it's known that Karol Wojtyla, who had gone to become Saint John Paul II, was a little bit of a shadow writer on Humane Vitae, so a lot of the basis of his theology of the body is in there as well. It's essentially put forth an argument against contraception, but it was also a very prophetic document in that it kind of laid out the groundwork of the next 50, 60 years, in terms of this is where we would be heading, if contraception becomes mainstream in society. He talked about a lot of things like the artificial reproductive technologies we have, which weren't around back then. He talked about, surrogacy and the issues we're having with that, and, with donor egg and donor sperm and a lot of the ethical conundrums at the moment. So it's a really amazing document, but essentially it's based on the argument that within every sexual act within marriage, the full meaning of the marriage is enclosed in that act. And why do we say that? I guess because, number one, the sexual act is the consummation of the marriage, but it's also the completion of that sacrament. In that, when you have baptism, the words of the baptism are, I baptize you in the name of the Father, Son, Holy Spirit, and the action that occurs is the washing of the water, and that symbolizes something going on spiritually in the background, which is the cleansing and the entering into, God's kingdom. So it's a similar thing with marriage. You have the words that you say, the vows on the altar, but the act that embodies those vows needs to come, which is, the sexual act. So, when we talk about the sexual act, every act of coming together of a married couple embodies those whole vows in it. So we say that every act has to be unitive and procreative, and you can't really separate those two meanings of marriage or meanings of the sexual act. And so he laid forth this argument, saying that contraception essentially comes in between the procreative, and by coming in between the procreative, you are affecting the fabric of the marriage, the unitive and the unitive aspect of the couple coming together. And so, outflows from that, divorce culture and all these types of things we could go into. Yeah. So I hope that was a little bit of an overview of Humane Vitae and what happened. But in Humane Vitae is a call. Essentially, it's like a call to arms to not only to married couples, but to men of faith and men of science. And Dr. Hill just took on that call, and he said, we have to look, for other ways and for other methods. So that's when some of there were already some NFP methods, natural family planning methods, in use, but a lot of them started to be kind of expounded upon and developed and get a little bit more accurate. And then he realized that, through essentially just listening to a woman's cycle and a woman's body, you could see a lot going on in the background. You could see a lot going on about, her hormones, whether she's ovulating properly, if she's got irregular cycles, irregular bleeding. And he used that as a basis, as a method to go into looking at the medical reasons of what's going on in the background of a woman's cycle. And that's why we say it's essentially, it covers, a lot in women's health, not just fertility, but a lot of things, obviously, that can go wrong in a women's cycle, in a women's health, can impact your fertility. Yeah.
Wow.
Long answer,
Goodness.
sorry.
No, it's
That's
great.
great.
That was great. Thank you. Firstly, on Humane Vitae, it's like, while you were talking, I just thought the language that we use, like to speak about procreation and things like that, is so different to like everyday use of language now. Like we don't just talk about like unitive and procreative. Wow, unitive and procreative, and how we can't separate the two and things like that. And thinking about like always being open to life, through the sexual act and things like that. Like now we talk about, I mean, it's not necessarily the worst language, but I just think it's so strange is like when people say, "Oh, we're trying for a baby," and I'm like, "Oh, like only kind of always like not necessarily like trying, but like that openness is there. Like whether I don't know, it's just weird language to me. Or like when we had Paul Hanrahan on the podcast last year, and something powerful that he spoke about was not speaking of life as wanted or unwanted, but that it's just it's a gift, but the language that you were just using while speaking, I was thinking this makes it just sounds more natural, I guess, which ironic, natural procreative, but but like it really does sound more like just in line with who we are, and so it just, I think before even before getting into like the whole medical side of things or whatever, is first the realization that it's not about now we want to have kids, so we're going to try and whatever and do all of these things. It's like there needs to be that openness, the whole time. Otherwise there's something off. I don't know, like this. I don't know. Sorry, I don't know if this is making sense, but it's just something that struck me while you were talking. I was like, that's such...
It does, definitely.
Yeah, such more...
It's kind of losing sight of a lot of that you explained. I think today we have a tendency, because our lives and our world is so materialistic, to apply that to everything and see children as kind of a bit of a commodity. But going back to that, the view that essentially that the power to co-create with God lies in that sexual act. God could have chosen to keep making humans like Adam and Eve and create them out of nothing. But after Adam and Eve, he chose to allow us to, essentially co-create with him through our sexual act. And just seeing that as essentially a supreme gift. And, I always like to go back to how this is explained a little bit in Theology of the Body, but how our bodies mirror God, essentially, and how the sexual act mirrors God. We can never really understand the Trinity because it's a mystery, but in some ways we can say, we can kind of draw parallels to how the Father gives himself completely to the Son. The Son receives that love and gives himself completely to the Father. And then, through that, through that love, a whole new person of the Trinity is generated, proceeds forth the Holy Spirit. And so it's a very similar thing that's imaged in marriage and in the sexual act, where, the husband gives himself completely to the wife receives that love and gives herself completely back, and the possibility of new life coming forth is there. And so that's how also we're mirroring the Trinity. So you can get in really deep into that, but I guess I'm just trying to say that we need to keep that view of, children being, essentially a supreme gift from God.
Wow, amen. Wow, you said that so much more cleaner than I than I did. Sorry, were you going to say something again?
With saying that, I feel like a lot of the older generation, like my parents' time, or like even sometimes the grandmothers and the grandfathers, they'll hear like young people our age, like 23, 25, whatever, getting pregnant, and they'll like their first response is, why would you do that? Like go get married, but like don't have kids straight away, go travel. A lot of the older generation do that.
But they were getting pregnant at like 19.
Yeah, I know. Well, I think that's
contradiction.
That's why.
Yeah,
but
yeah.
anyways, but then you have also the progressive society that's also saying like, wait until you're 30, like spend those 10 years, be financially ready, stable, have your holidays, go away.
If you want.
Yeah, I've just
Wanna have
lost
kids.
my train of thought.
Oh, sorry.
No, it's okay. I don't remember why I was asking the question. I think it was more so just like, what do you say to like waiting to have kids? Is it something that you find is a big issue in your field, like because people waited too long, or like it wasn't a priority to them? That wasn't my question, but that's I'll go with that.
Not necessarily. I mean, I don't think it's for us to judge anyone's circumstances. You know, I would say as a basis, and what we teach in like the marriage classes, is if you're not ready to have children, then you're not ready to get married. Because I think, as we've just been through, every act of intercourse in the marriage needs to be open to that possibility of having children. The question of waiting is a little bit different from my point of view, from a medical perspective, because there are valid reasons why a couple would need to wait and need to not have children for a certain time. And that's where the NFP methods come into play, because you can do that morally by just abstaining, say, from during a fertile time in the women's cycle. It helps build a little bit of virtue, and then only coming together when you know that you're not going to be infertile. That keeps the act of intercourse still open to life. You're not blocking, you're not contracepting in any way. And so when we talk about, you know, what are the reasons that a couple might be able to, say, space out births, or to decide not to have a child at this time, it does have to be a very serious or a grave reason, whether it be, you know, a severe, you know, physical issue, you know, medical problems, and your health is in decline, and falling pregnant would, you know, throw a wrench in the works. It could be psychological problems, it could be social, or, you know, even financial. There are valid reasons. But the call is for the married couple to discern that themselves. I don't think anyone outside marriage can really make that decision. You know, you can ask people, you know, trusted priests, or, you know, people that, you know, mentors and things like that, but they can never make that decision for you. It's the only people that can know, you know, what are the factors that go into making that type of decision is the married couple themselves. So I don't think we can be ones to judge from outside, like they've decided not to have children now, or they're waiting for a specific reason. But they do have to be grave reasons, and it can't just be because I need to save up a bit of money and get a new car or something like that. Yeah. Hope that makes sense.
Yeah, it did.
Cool. Just on that, like on what you said at the start of your answer, and I hope I'm not going too far off, but when you said, you know, in marriage classes, like you'll say, if you're not ready to have kids, then you're not ready for marriage. I want to, if you don't mind, I'd like to go a bit into that, because I remember saying that to my old boss at work once. We were just talking, and he said, you know, too many people now, they get married and they spend all these years traveling and all this stuff, and they don't want to have kids and whatever. And then I said to him, I agree. I said the same thing. I said, why get married if you're not ready to start a family? Like, it just doesn't make sense to me. And so, you know, I remember saying to him, when I get married, I'll want to please God, but I'll want to have kids straight away. Yeah. You know, like, and then he kind of laughed at me. He's like, you say that, but wait till you get married and things like that. You know, things will change and all this stuff. And I was kind of adamant, like, no, I'm not going to change. But then, but if he was to ask me why in that moment, other than me just saying it doesn't make sense to me to get married and then not have kids, like, or not want kids straight away, other than the answer, it doesn't make sense to me, I don't actually know why. So I hope you don't mind me asking, but Why?
I'm by no means a theologian, so I can try and answer it. But I think we've touched on a little bit of why. It's because when you're on the altar and making the vows to be fruitful is one of the vows of a marriage. Then the next thing you're going to do is some form of act that stops that openness to life within the marriage. So you've already broken the vow. You've come in between that procreative aspect of the marriage. I would say that it's in the very fabric of a marriage to be, to want to be parents from the very outset of it. Because we're saying that procreative aspect is inherent to the marriage. That meaning can't be taken out of the marriage in any way. And so I think if you're going to get married and start trying to avoid having kids and wanting to live your life and say be a bit more selfish, forgive me for saying, then you're already coming in between the fabric of that marriage.
Oh yeah, that's really good. That actually helped me put it together in my head and to say, and it kind of, and again, I don't want to go too far off, but it does really help me make sense of it in my head. In that, I think that's how trivialized, I suppose, we've made marriage.
Yeah, and I guess it also, you can go into what is the purpose of the institution of marriage. Which is to me, it's a very basic answer. It's for it's for that building block of the family. So why would you want to be married if that's not going to be part of the purpose of the marriage from the very outset? That openness to having a family, because essentially all of society develops from that building block of the family.
Wow, yeah.
What about like Catholic couples? So if they've grown up Catholic, like Anthony and I, we can't go away together. We've never been like alone in proper situations together. We've had minimal experience of actually existing just us two. And then we get married and then you're telling me that we should have kids straight away. Like how do you balance, like, I know you're not like, your expertise isn't marriage, but like, what about like getting to know each other as husband and wife and then you throw a kid into it straight away? Like, what about that? I
mean, having 3 kids under 5, I would say the best way to get to know each other as husband and wife is through your children and through kind of the struggles and the chaos that comes with kids. I thought I knew my wife. She's an absolutely amazing woman, but I know her so much more, since we've had children and going through those struggles together. Like I can't say too much about that whole mindset of wanting to, get to know yourself and get to know each other and enjoy your lives. But yeah, I'm trying not to be too gentle. For me, I think that's a byproduct of our I guess more selfish modern day that we live in. That's very focused on the person. It's not very focused on the family. And you should have your own experiences and your own journey before you move on to the next step of your life. Whereas sometimes that's not God's plan for you. Our call is to essentially live in a community and not be so focused on ourselves. And sometimes we don't really know ourselves until we've done charitable work or look after other people or being involved in other people's lives rather than focusing on so much on our lives. Yeah.
That's beautiful. Yeah. Shout out to your wife.
Yeah.
Thank you.
So I imagine that that most people, if not all people coming into the clinic are trying to, at least for NaPro, are trying to fall pregnant or trying to have children. So what does that journey look like for someone who wants to conceive, for example, or a couple that's looking? So honestly, the language with this stuff is really it troubles me so much. For a couple that's trying to fall pregnant, that's just, I don't know. Yeah. What does the journey look like from when they first walk into the clinic to have a chat with you, and then until conception, basically? What does it look like for them? Please, God.
It's different for every couple. That's probably one thing about our approach is it's not an on-rails approach. I see a lot of couples who've been through the traditional medical system, they don't really have, causes for their miscarriage investigated. What we were taught in the traditional field is, once you have 3 or more miscarriages, we can start looking into reasons behind it. But for us, every life is important, and I start looking into it if a couple's had just 1 miscarriage. Not just for that, for infertility itself, they go through a bit of an on-rails approach, where they might have had some simple tests, they might have had a surgery, but essentially it's all in the view of getting them to do IVF, which is a story that I hear again and again and again, that we felt like things weren't looked into, we were just pushed to have IVF. We were told that there's no reason and we can never fall pregnant, and we just have to go and do IVF, and that's our only hope. So I guess what I'm trying to say is we move away from that on-rails approach, and the approach is different for every couple, because as we explained, we do this full assessment, the medical factors that go into it, the lifestyle factors, everything really that we can dig into, we try and dig into. And then sometimes I'll ask women to start charting with the Cradle model, which is one of the NFP methods that we use, to get a better idea of her cycles and to be able to better investigate, and also you can give us a view of what's going on in the background as well. And then we will come together after that initial kind of investigation period, and also instilling some lifestyle changes. So that might be, a few weeks or a couple of months later, and then things tend to get a lot more detailed. We get down into kind of the nitty-gritty. These are the results showing this is where I think the problem is, or the impediment is. These are all the factors that need to go into fixing it. And some of those we could already identify maybe on the first visit, but we just need confirmation with certain things like investigations. So to tell you, how long the whole journey takes, it's a little bit difficult. It obviously depends on what the issues are, and there can be so many issues that are involved in that.
You touched on IVF, and apologies if I'm going all over the place, but when you mention something comes, it just gets stuck in my head. And so you touched on, again, IVF, and for me, I know it's a bit more difficult for me to even speak to someone about, because if we're speaking about abortion or euthanasia, those sort of issues, it's a lot. For me, I'm almost ruthless when it comes to it.
Yep.
Because again, it's like pure evil to me, that sort of thing. But then when it comes to IVF, we're not dealing with the destruction or the murder of innocent life. But now we're talking about wanting, these are people who want life.
Oh, yeah, definitely. I think the intentions behind it are very good intentions. Yep. That call to want children is at the very core of a Christian marriage, is like we just discussed. But I just think the way that it's presented practically is where things go wrong. We can talk about the church's objection to IVF. I think without getting into too much detail theologically, the way I see it is contraception is coming in between the procreative aspect. So, you have sex without babies, whereas IVF is coming in between the unitive aspect, where you have babies without sex. It's a very simple way to put the church's objection to it. But the way that's done practically leads to a lot of moral quandaries and considerations. So obviously our objection is separating that act of conception, the creation of a human life, outside of the marital act, outside of the sexual act. That's our main objection to it. But then what goes into that is essentially the commodification of the embryo. So with IVF, they aim to harvest as many eggs in one cycle. So, there's certain medications that take over a woman's cycle, induce an abnormal ovulation, harvest, 4, 6, sometimes, even more eggs in one cycle. This can be very, very tough on a couple. You know, I've seen women end up in hospital after that for, you know, months at a time because of some of the medications and hormones that are used, because that's not a natural process of the body. And then what happens once these eggs are harvested and once, you know, the sperm is collected, we've spoken about how sperm collection occurs as well. You know, it's really, I have to be a little bit careful when talking about these sorts of things. But for me, you know, IVF has really become more of like there's a lot of financial interest, and so it's a business model essentially. So they try and maximize their chances. So they would essentially fertilize as many eggs as they can. And then through natural processes, some of those embryos, which are now human lives that have been created, will end up, you know, being discarded or frozen. You know, there are some that might be poor in quality that, you know, they're not going to choose for implantation. So what happens with those embryos? You know, these are human lives that are now being sitting in a freezer, or that are discarded, or that might just naturally die because, you know, of the quality of them. So, you know, that aim to have, you know, children is a very good way. Is a very good desire in a marriage, but we have to be careful about the means in which we want to do that, because obviously, you know, you said that, you know, abortion is dealing with, you know, the killing of human life, but this is human life as well. So you have those same types of, you know, dilemmas in IVF. So, you know, not just speaking ethically or morally about what goes on, and then we can go on and talk about all the outflow of ethical issues that flow from that, you know, like surrogacy, donor egg, donor sperm, all these types of things, you know, genetic manipulation and selection as well. Yeah. You know, that all comes from using artificial technologies. But I guess, you know, putting that aside, all the ethical stuff, I also have essentially a medical qualms, or I guess a bone to pick with IVF, because, you know, like we said earlier, they're telling people that this is your only option. They're not really going into the reasons and the causes behind it, which we know, you know, there's a lot that can be treated. And it's essentially become a bit more of an industry. Yeah.
Wow, so
isn't it like $15,000 every time they do a new? Is it implanting?
Yeah.
Of
it used to be. There's a bit of a Medicare subsidy now, and it's about $8,000 to $10,000 a cycle in Australia.
Still so much. Yeah. They go through like generally 4 or 5. Right?
Yeah, I've seen couples who've been through about the most I heard was 12 cycles of IVF.
Oh my goodness.
Yeah, and in one consult, I was able to identify, you know, a lot of issues that can be worked on, and she thought that, you know, she didn't have a reason for being infertile. They just keep, you know, pushing them through the process. Yeah.
Oh my gosh.
Wow.
What the heck?
Yeah, it's horrible sometimes.
That's crazy.
Yeah, that's why I have like a medical issue with IVF as well, not just the ethical problems, because we could be doing so much more for our patients, and, you know, sitting them down in front of us and looking at them as a person and as a couple with their own struggles, rather than, you know, having them on what I said is like just a on rails approach where they're just, you know, on the conveyor belt through, you know, let's not figure out what the issue is. Let's bypass the issue, again, treating infertility as the diagnosis, you know, as the label, and get around it and force a pregnancy on this body that, you know, is screaming that, you know, something's going on, I can't even hold a pregnancy. So it also leads to high risk pregnancies. You know, the risk of multiple pregnancies is higher in IVF. The risk of preterm labor is, you know, very well documented.
What's multiple pregnancies? Isn't two?
So like twins and triplets and things like that.
Which are more dangerous?
It comes with increased risks, obviously, to the mother. It can be a beautiful thing to have.
No, yeah.
And things, yeah.
Wow.
Do you find there's a huge mental toll with it as well? Like with the IVF?
Yeah.
It's a long process. And injections, is it every day or something?
It can be for certain periods, yeah.
Do you think IVF might take more of a mental toll than something like just infertility or like, or a miscarriage or something, because it seems like it could create a sense of false hope if it doesn't work out, rather than almost like a disappointment is an understated word, but like,
I mean, everyone is different. It's hard to say, what's going to have more of a toll on someone.
yeah, that's fair. Actually, that's a fair point.
And then I guess one thing just to, talk about some statistics, because we spoke about that 60 to 80% success rate in NaPro technology over the first year.
Yep.
And that depends on what condition you're dealing with.
Yep.
Whereas with IVF, the success rate is typically 20 to 25%. Some cycles can go up to 30%, but usually not greater than 30% in one cycle success rate for IVF. So it's hard to compare apples to oranges, because you might not have one cycle in a year. You might have multiple cycles, or some people do one cycle every 2 or 3 years. So you can't really compare, and the studies you can't really compare. But I would say that on the surface the numbers look a little bit better, and we say that if the worst possible outcome through our approach is that you get yourself healthier, and when we find some reasons why you're infertile, and we fix those, and we help with the male, and we help with the female's health. That's the worst possible outcome. The best possible obviously would be falling pregnant and fixing your issue, so that we're not just focused on one pregnancy with IVF, but we're focused on fixing your issue, and then you're allowed to God willing, build a family in the future, and you don't need to go through that process of IVF every single time you want a child as well.
Wow, that is beautiful, and that also touches on something that you said earlier that really struck me, which was the ability to actually hold the pregnancy. If I hope I'm using the right terms again, but that is something that I'd never thought about with IVF. Is it could. It could work out and life is created. Yeah. But then do you have the ability to actually hold it and nurture it, like, in your body? And if there's a deeper issue that's not being treated because you've just been told to do IVF, which then makes, from everything you've just said, it now seems like, I know earlier I said that NaPro seems like a really simplistic sort of thing, which it is in a sense, but now it seems like IVF is like the really oversimplified solution to a much deeper problem. Yeah. And so they're just like, it's like, ignore the problem. Here it is. It's simple. Just go do IVF. Yeah. Whereas, NaPro's.
You're right. It's led to lazy medicine, essentially. Yes. Yeah. But yeah, I don't know how. I think it's also just a product of our medical system. Obviously, it's also a product of the wider society and our views of how we see children and conception. But what I mean by a product of our medical system is that there's our system has become very compartmentalized, and so if a couple's struggling to fall pregnant, then the solution is, let's look at what are the factors that go into making a pregnancy, sperm and egg. Let's bring them together. Let's create a pregnancy. Sorry, I lost my train of thought. But essentially, saying that our medical approach has become very compartmentalized, in that not just talking about fertility, but say you can have an ENT specialist these days who only deals with ears. So even more specialized than just ear, nose and throat. Yeah. You go and you see your cardiologist, and some cardiologists are electrophysiology of the heart, so they only deal with electrical problems. And things are just becoming more and more compartmentalized and specialized and going deeper. And it's a beautiful thing. It's an amazing thing that we've been able to go into that much detail in modern day medicine. But who is stepping back and looking at the person as a whole anymore? And looking at all the factors that go into that person sitting in front of you, on the chair that you're talking to. So I guess that's like that comes with our whole holistic approach to NaPro, and that's kind of what drew me into it as a GP, because I realised that that's kind of our job as GP specialists in Australia is to be the people that, you know, have this focus on the whole person.
Yeah. That's become something that I've been more aware of, is especially when it comes to the medical sort of field, like even something as simple as like a dentist. But it's so important for me now that and this might sound problematic to some people, but it's so important for me that they're Catholic, because they're able then to actually give a properly holistic, or they're able to take a properly holistic approach, because they understand the person as a body soul composite, and they're able to treat that whole person, rather than, you're right, just like that you know, one little issue they see, and they're focused on this, like this little thing, rather than, you know, the whole person, which is, that's such a powerful thing, and it's becoming clearer in my head as you as you talk. So that's great. And yeah, I think you're I think you're right, as if like
I appreciate that.
but as in
a doctor of 10 years, I think you're right.
Yeah, but as in like, yeah, I think, you know, it just makes so much sense that like the compartmentalization of medicine, or is while it is a great thing, you're right, like that we can go so much into detail, we can't just be looking at that little thing. And I think, again, like, it all really speaks to this mentality that we have now, that we're just entitled to everything in life, and so children are you know, a part of that. We're just entitled to it, which we're not. You know, it's again that idea of children being a gift. And so if we can, if we can kind of do what we can do in making ourselves like the best, you know, at least in whatever sense, physical or mental or whatever, even spiritual, then that's almost us saying to God, like, we're ready if that's, you know, what you will for me, kind of thing, rather than just playing God and going and, you know, I don't know if that makes sense. And like, worst case, you're a better person for it. Best case, you have another child. Like, you have a child, you know? Exactly. So, I mean, this is really, really, honestly, so beautiful for me to hear. And again, I apologize for my ignorance and everything, but I'm really learning here. So it's been great. I want to, I mean, I know of some people, even in my life, who are Catholics, practicing Catholics, but aren't aware that things like IVF, for example, are, you know, against the moral teaching of the church. Or even just the theological teaching of the church. And so what would you say to someone who, it's not just IVF, but for people who are struggling, who are looking at all these other artificial ways to fall pregnant, and who are just looking for that sort of solution where the only outcome is I have a child. What would you say to someone who's going through that, and why would you recommend NaPro for them if you were to speak to them directly, I guess?
I think if you had asked me that question a few years ago, maybe even 3 years ago, I would have come at it from a very different place. I think I was in that very kind of black and white stage, you know, very judgmental. IVF is wrong. This is what happens to embryos. They're discarded. We're killing off life, that type of thing. But through this work, through, you know, NaPro Life Centre and the clinic we started, and my journey into that, I've had a lot more chance to sit down and speak to these couples and hear their stories. And I would say a lot of the couples that I'm seeing have been through IVF and have failed. And they look for other answers, and they come to us as a last resort. So over time, I've built a lot more compassion to them. So, you know, they might not know that it's wrong morally. They might not know that, but also I think there's a little bit of coercion in the medical system towards IVF. in that they're not given any other option. They're told multiple times from multiple doctors, this is your only option. There's no, we have unexplained infertility. And so, a little bit of that, can you really blame them for being pushed into that side of things when that's just, the way our whole system is built these days. So I think what I'm trying to say is I have a lot more compassion for them and hearing their stories. And I've learned that I should, never really judge anyone for that. But educating them going forward is important. But a lot of it is what we've spoken about already, is how I kind of sell NaPro to them. This is going to go into the cause and the root issue of your problem. It's not an easy process. You do have to be kind of dedicated. But, at least there's someone working with you to, find an answer and to fix your issue. Yeah.
I don't know how deep you can go into this, but what's been the most challenging sort of case for you, I guess, that you've seen? I don't know if you can go into that again. But.
There's a lot of challenges. Honestly, I think I might come home from a day at the NaPro clinic and say to my wife, today's cases were the most complex I've ever seen, and every day is like that. There's a lot of challenges and a lot of complex cases and a lot of issues. I think what's been challenging for me is dealing with some of the ethical problems. There's couples that tell me that they have embryos frozen. So not just sperm and eggs frozen, but they have frozen embryos, and they've that's been done obviously through the IVF process, but they've learnt about the moral issues with that now, and they're not sure what to do with those embryos. Can we? I had a lady say to me, I want to have all my babies. They're sitting there in the freezer, and can you help me get healthy to do that? And so that's like it's a very tough ethically question. Yeah. Because for me, I think that the act of IVF, the sin, that the creation of the embryo has been done. Where do I lie in that process of helping a woman, have these children, have these babies? So there's some very challenging things that we can deal with ethically. I think I find that the hardest. Medically, you can get quite detailed and into a lot of things, but it's the other side of things that I find harder, actually.
That is so tough.
Do you have a contact in the church that helps you with that?
Yeah.
So you have like a spiritual director, and you're like this.
So where I studied, this St. Paul VI Institute in the US, we have a full-time ethicist that I can contact. You
studied in America?
Oh wow.
Yeah.
Oh my goodness.
Studied in America. So this is where NaPro technology was developed by Dr. Thomas Hilgers, and he named the institute Pope Paul VI Institute after Pope Paul VI, who wrote Humanae Vitae, and then they changed it to St. Paul VI Institute when he became a saint.
Sorry, yeah.
So we have an ethicist there, Sister Renee Merkes. She's amazing. So we can contact her whenever we need, and I've had to ask her a lot of questions. But also having like a good network of priests that you trust here locally, speaking to the bishop about certain issues, things like that. So always have to be in contact with people who know much more than I do on that side of things. Yeah.
What do you do in that case? Like, the act is already done.
A lot of these questions are, there's no clear answer for them. There's no clear answer. You might speak to one theologian or ethicist who would say, this is permissible, or another make an argument for why something else is permissible. Yeah. So there's a lot of kind of, I guess, discernment in the process, and prayer and involving God, and just kind of drawing your own boundaries in your own line, and not kind of overstepping that. So I guess where I've drawn a boundary or a line is, to me, NaPro technology as a process is doing everything we can to kind of support the act of natural conception, and leaving the act of intercourse between the man and the wife to themselves. So that's kind of where I've settled to draw the line myself.
Nice.
But that's not to say that it's not a wrong thing to assist a couple, who want to use their embryos.
No, that's fair. Yeah. That's awesome.
So in terms of your own faith, are you have you struggled to just remember that it's God God first and not like I feel like I would have so much empathy for my patients in situations where I would struggle to tell them no, like you can't do that, because like in that situation they have an embryo, like they actually have children, and they just want to have them. And I would like if I went to the ethicist and they said no, you can't do that, I would struggle so hard to come back and like deliver that information, because in my brain I'm like, but it's life, like obviously your faith would have to be so dependent, and like you'd have to be so selfless and like surrender to God completely in terms of that. Has that been like a struggle for you, or like has it been something to...
Yeah, I guess so. But it's also just because you might draw a line morally or ethically, it doesn't mean that you have to completely remove yourself from the situation. Obviously, God's put that person in your life for a reason. And so, you know, I might say in a situation like that, I'm you know, there's a lot of other issues we can work on. You have health problems, you know, you have problems with your hormones, your cycle, endometriosis, PCOS, whatever it might be. Let's work and let's fix those. And so always, you know, trying to find a way to still help that person and connect with that person. Yeah.
It's really great.
Sarah sorry, I'm going to put you on the spot, but you mentioned a question that you wanted to ask when we were in the car on the way here.
Which one?
And I said, I don't know, the one about men or something. And I was so confused because I was like, is that a thing? Like, I didn't even know. And I was like, okay, well, that's a good question to ask because I didn't even know that.
I don't know. I have all this stuff pop up on my Instagram. I'm on like baby Instagram for some reason.
Yeah.
I've just seen so much. I've also I know someone that's a naturopath. So I just have so much conversation about it and like the holistic approach to things. But I've heard a lot about how men actually contribute mostly to like the building of the placenta, and they can contribute to like whether you're going to have morning sickness, and it's like the sperm that decides that. I've never spoken to a doctor about it, so I was just wondering if you had any opinions on like how much does the man actually impact the healthiness of the birth. Like let's say the woman's body is ready and so she does fall pregnant, but will the man's sperm impact negatively depending on his own health?
Yeah. So there is such a thing as, you know, sperm quality and egg quality. So, you know, there's probably an infinite number of things that can go into, you know, what impacts sperm quality and egg quality. And so if you have, you know, speaking specifically from a male point of view, one of the main things that impacts sperm quality is, you know, oxidative stress in the body, which leads to, you know, breakdown in DNA and things like that in sperm. And so obviously if your sperm aren't the best quality, you can still have a conception occurring, but the embryo might be of a lesser quality, and that might lead to, you know, problems with implantation or early miscarriage or that type of thing. So, you know, in a lot of situations that can be the cause for recurrent miscarriages, just improving, you know, general sperm health or general egg health through those naturopathic means. Yeah.
And so like nothing about morning sickness, like does I
haven't seen a link to that specifically.
Oh yeah, okay.
Yeah.
I was just so curious about it.
Yeah.
It's really interesting. I mean, this is going to sound like a stupid question, but whatever. I've been stupid this whole podcast. So
you definitely haven't been.
I appreciate it. So for someone like me who, you know, wants to, please God, be married soon and have children, what can I do from now to prepare well for that? Like in terms of my own health and things like that.
Yeah. I think without digging into like specific medical history, but looking, you know, overall, what are the things we can do? Just make sure that you're in a good, healthy place medically, that you don't have, you know, any certain autoimmune issues that are uncontrolled, inflammatory problems, and then, you know, certain medications that can impact things as well. And then moving on to just the kind of general advice would be, you know, having some sort of exercise or physical activity in your day-to-day life. We live very, I guess, sedentary lifestyles. it's much easier for me to preach this than to actually follow it myself. But yeah, like, the benefits of exercise, we can go on for ages, just the general health benefits. But, when we talk about fertility specifically, it's something like the release of, certain hormones called endorphins that help regulate things for males and females. So having some good cardiovascular exercise is really useful. Diets, again, we can go in very, very deep. Some of my patients, we have to put them on, completely gluten-free, completely lactose-free, these anti-inflammatory diets, PCOS diets, endometriosis diets, that type of thing. We can get into a lot of detail, but I think just as a general good starting point, it's certain things just being aware of, processed and refined sugars, your ultra-processed ingredients in your food. So, if you pick something off of supermarket shelf and you don't recognize, what's in the ingredient list, it's just a chemical, that it's not a food, then don't put it into your body, There's certain things like that, staying away from all the fun stuff, really, sweets and
No fun.
yeah, exactly, takeout and fried foods, and just being really aware of that. And, these days there's a focus on, the oils we use for cooking as well, like synthetic oils, that canola oil is made out of basically nothing, and, going back to more natural, avocado fats and beef tallow and things like that. So there's a lot you can do from diet. We mentioned exercise. We've mentioned mental health already, and, making sure you're in a good place and you're able to cope with your stress. There's no one that doesn't have stress in life, especially living in Sydney. But you're able to kind of cope with and process that. And, I would say, as long as it's not affecting you physically, smoking might be a big one in our community, especially with, young males and nargileh and things like that. Alcohol, making sure you're not having excessive intake. We spoke about sleep already, and that's important for rejuvenation of bodily function. So there's a lot you can do, but it's generally living a healthier lifestyle.
That sounds good.
Yeah.
I like that. I can do these things. Go
Yes,
for it.
you can.
Go for it.
I've turned into my sister and I, we've gotten really into like the whole clean eating and like the food that God gave us and the oils and the microplastics and stuff like that. And I feel so bad. I've been ranting to Anthony about it for so long.
Sorry. It's only helpful.
My only question is, what's something people are doing that they don't realize is actually affecting health? Like, what's something that people come into the clinic and it's something that seems so ordinary these days, but they don't actually realize is like a huge contribution to like infertility or like just not being healthy?
That's a really good question. I have to think about that. I think a lot of the things I mentioned, and just pointing that out to people, they don't realize how much a lot of those factors can impact, even like your sperm quality, or how they can, impair ovulation and things like that. So from that point of view, there's a lot. What's the most specifically? I'd have to think about it.
That's okay. Sorry to put you on the spot.
It's okay.
That was a good question. You can sit here if you like.
All right, next time.
Very good. Who's the journalist? And so those things that you spoke about, the exercise, and obviously, I mean, they'd apply to both men and women. But are there specific things that conditions, I guess, that women are more susceptible to and men are more susceptible to, that certain practices can be put into place, does that make sense? Is there something for women that they can particularly do and men that they can particularly do to limit those chances of?
I might have already mentioned a couple of them with women, things like PCOS and endometriosis. There's ways that they can be controlled through lifestyle and diet. But I wouldn't just focus only on lifestyle and diet as a treatment for those. You do have to get deeper and get into the medical issues and the hormones and look at all of that as well. But as with everything, it's a good starting point. And one thing I haven't mentioned is I have, a good regime of supplements. I find that that's a really good starting point as well for a lot of couples. So there's certain supplements that we know, that there's evidence that they help, improve sperm quality or, help improve, say progesterone support in for women, after they've ovulated and things like that. So it's always like a very good starting point for me that I can build on my medical treatments on top of. So we have a little bit of a supplement regime. It's not like naturopaths or anything like that, maybe a bit less than that. But yeah, I usually instigate that on the first visit as well.
All right, guys, does your foot roll in like mine, or maybe even roll out? Or do you just need general treatment for nail and skincare? For any problems with my feet, I go to MJ Podiatry. They're a mobile home visit network servicing all of Sydney, offering expert podiatry care for general treatments, sports injuries, custom orthotics, ingrown nails, and footwear advice, and offer NDIS and home care packaging. Visit mjpodiatry.com.au, call 0412 389 278, or email info@mjpodiatry.com.au to book your appointment today. Use code ATG10 for 10% off your treatment. Would you mind if I just throw that to you now, and if you can go through certain medical conditions, and let us know, like, well, firstly what they are, especially for me, and then like what you do in your work to treat them. Yeah, is that all right? Let's do that. Let's jump straight into that. Is that okay? Okay. Awesome.
So probably on the female side of things, the two main conditions we see are PCOS and endometriosis. So PCOS is a metabolic disorder. It's very much a lifestyle issue. One of the main, precursors of PCOS would be, issues with your glucose metabolism and insulin resistance and things like that. And then, what the effects are, from a women's cycle point of view, is that, towards the later stages, it can lead to hormonal imbalances, which lead to, issues when you're coming into ovulate in your cycle. So, generally, just to run you through a woman's cycle very briefly, the start of the cycle, you have a dominant follicle on the ovary, and this is what's growing, releasing estrogen, and is coming to ovulate and release an egg. And then after, that egg is released, the post-ovulation phase, we call it the luteal phase, that follicle that was dominant on the ovary becomes what we call a corpus luteum and starts releasing progesterone. This is very important for, early pregnancy support, to help with implantation as well. And that's usually the main source of progesterone for an early pregnancy up until 8 to 10 weeks of a pregnancy when the placenta takes over. So obviously if a conception doesn't occur and there's no implantation, what happens is your endometrium, the lining of the uterus, starts to shed, and that's where a woman gets her period. And so I guess a lot of people have that focus of your period being the focal point of your cycle. But for us, it's all the lead up to ovulation and the after effects of ovulation. So the crescendo itself is ovulation in a woman's cycle. So going back to PCOS, what would happen is instead of having just this one follicle developing coming up to ovulate, stop me if I'm going into too much detail.
No, you're good.
Or if it's not making sense.
No, you're good so far.
But with PCOS, instead of having just one follicle developing coming up to ovulate and release an egg, you get multiple follicles because of hormonal imbalances, and they're all kind of competing. And so, they might compete for ovulation. You might get an abnormal ovulation, or very rarely in like severe PCOS, you get an ovulation. So you don't get any ovulation. That's explaining PCOS, explaining endometriosis through this whole kind of cycle as your follicles developing and releasing estrogen. The estrogen has effects on your uterus and the uterus lining that starts to thicken and get ready for implantation. Once the egg is ovulated and then fertilized, you need to implant the embryo and start growing the pregnancy. So the estrogen acts on the lining of the uterus called the endometrium, and that starts to thicken. Endometriosis is a condition where that lining starts growing outside the uterus. I describe it as a bit of a cancer, actually. It can be quite invasive. It can grow on the outside of the uterus. It can grow on the fallopian tube and block things. It can grow on the ovary, block ovulation, but not only on the on the women's organs, the pelvic organs. It can grow outside of that. It can go on the bowel and lead to problems. It can grow. There was a case we studied in the US where it was growing on a woman's diaphragm and all the way up, up the abdominal cavity. So it can be really, really invasive, and it can have a lot of hormonal imbalances as well. Very commonly, PCOS does need surgery to treat it. So those are the two main conditions we deal with: PCOS, endometriosis. But there's a lot more than that. There's issues that can impact the whole process. Going up into ovulation. Issues with hormonal imbalances that can impact that phase after ovulation. So our approach really is on I guess from an overview of the medical side of things. I think I said it earlier, but what we aim to do is to work with the cycle and not overtake the cycle in any way. So again, as I went through medical school and training and things like that, the treatment for PCOS is to put women on the pill, the oral contraceptive pill. It's a synthetic hormone. It's kind of just taking over their cycle. And it's a similar thing these days as well for endometriosis, to help control the pain and the heavy bleeding that can come from endometriosis. So it's just really controlling the symptoms. And they really only do surgeries for endometriosis later stage, or when women have very severe symptoms. And then when you're talking about the pill itself, it's not what we call a bioidentical hormone. So they're synthetic hormones. They're aiming to give a woman estrogen or progesterone, but they're not actually giving the molecule estrogen, estradiol, or they're not actually giving the molecule progesterone. They're giving essentially, progestogens, so progesterone-like molecules, which might be 2 or 3 chains up the metabolic ladder before you get to progesterone. It has to be metabolized into that, and obviously it's going to be metabolized into other things, and that's where you get a lot of the side effects from. Whereas if I want to give a woman progesterone, I'm going to give her what we call bioidentical progesterone. It's a lot more in use now because some of the IVF clinics have taken up this practice as well. Similar thing with estrogen, but we're not really taking over the cycle. We're instigating certain treatments at different times of the cycle so that we preserve ovulation, we preserve fertility. So again, it's not like giving progesterone, say, over your whole cycle in a pill that you take, and then you take a sugar pill and that's a withdrawal bleed. It's not actually having a period. Instead, if I need to give someone progesterone, they're not producing enough progesterone, I'm going to give it 3 days after ovulation, because if you give it too early, it's going to block ovulation and act as a contraceptive. So we have to get into the details of finding out for this woman, what is her cycle like, when is she ovulating, and it's not just guesswork. And that's where we go into some of the more detailed NFP type methods to track women's cycles, because I spoke a lot about progesterone and estrogen, but there's a lot more hormones behind it, but they're kind of the main two. And we know that at certain times of your cycle, they act on your cervix, and your cervix in a woman releases certain types of cervical mucus or cervical discharge. And so that's one of the biomarkers we use to track a woman's cycle. It's very, very accurate. It can tell us, issues going on in the background with, hormone production. So yeah, without going into too much detail on that side of things, we use the signs your body gives us, and we're really working with the body.
Wow.
I hope that wasn't too much of a rambling.
No, that was so good.
Yeah, that was awesome. I was just sitting here thinking, my goodness, if I was really lost, and if I was one of your patients that just came in and you were speaking like that, I'd be like, yep, I came to the right place. Yeah. He knows what he's talking about. But that's awesome to hear, how you go about that, because you said it earlier, and you said it again now, that you're looking to work with the body rather than against it. But that's, firstly, that really showed how much detail you go into making sure that it's actually it's working with the body naturally with it. and then again, it also, and I don't want to like bring it back to this conversation, but it really shows how something like IVF is completely, or the pill is like, it is contrary to, just the body's natural, I don't know, motion, I guess, or whatever.
The pill for me is really just masking all of that and taking over the cycle. And one of the issues that we deal with women who've been on the pill in the past, is they come off that and their symptoms are so much worse because the problem underneath has been allowed to kind of proliferate and to fester, say with endometriosis. Instead of dealing with it, early on when you might be, say, still stage 1 and, not very deep or not very invasive and not having effects, causing scar tissue all over the pelvis. What I find a lot of women are done is they're put on the pill, and it controls the symptoms. They're not having that much, pain, and they're not having very heavy bleeding again. But the process in the background is still ongoing. The endometriosis is proliferating. So then she might go to, get married or want to start having a family now, and she's come off the pill. Symptoms are so much worse, and the disease has progressed so much that the treatment, has to be a little bit more drastic at this stage.
Wow.
Yeah.
I have a kind of general question before we go into potentially like the men's conditions and things. But before I ask my kind of generalized question, do you have any particular questions that women might be thinking hearing that? Because I'm a man, I just think I heard that and went, yep, sounds good to me,
I don't know. I just feel like it got explained to me in so much more depth than it's ever been explained to me, what it is, but I don't have questions.
Cool.
Yeah, and that in itself is still a very surface explanation.
Yeah.
I would say.
Oh my goodness. Yeah, because you said, not to go into too much detail, and I was like, this isn't like already the detail. It's incredible what you actually look for and look into. My kind of generalized question is, like, when you talk about the difference between the treatment that, like the NaPro treatment and something like the pill or whatever other artificial treatments there are, how come, I don't know, is it just me that hasn't heard of NaPro treatment, or is it, like, how come it's, my question really is invalid if it's just me, but I feel like a lot of people told me that they didn't know either, but maybe we're just in this like really clustered tunnel vision world that we're living in. But how come something that seems so obviously like the right way to go about things, how come it's not as well known as things like the pill and all that?
I've thought about that a lot myself, actually. I don't know that I could give a 100% answer, but the way I look at it is historically. So we spoke about like the atmosphere that was going on in the 1960s when the pill was developed. But I guess, I thought about what happened medically around that time. Essentially you have a lot of money and research now into going into these artificial treatments. And we've spoken a little bit about how IVF is essentially taken over as an industry, this whole field. So, all the big institutions, big research, big money is going into that. So I think, essentially what NaPro has tried to do is pick up where the medicine was left behind and build up on that. And, so start doing their own research into these types of things. And also, that involves, developing their own surgical techniques, our own surgical techniques, I should say. I'm not a NaPro surgeon, but, we have NaPro surgeons that have a different approach. So we've spoken about endometriosis. The approach that I see a lot of women have had is they have endometriosis treated and it's burnt away, through certain means. The body is left to heal on its own, but this can in itself lead to a lot of issues with scar tissue forming. The way that they perform the surgery, is going to vary very widely because of training between, going to see one gynecologist and going to see another. Whereas with NaPro surgeons, they've developed an approach that's very standardized. They only use robotics. It's called near contact laparoscopy, where they're making sure not just to check the uterus, the ovaries, the ligaments and fallopian tubes, but they go deeper. They look at all the bowel. They look at, the pelvic side walls, the bladder in front and behind. And so they have a very systematic approach. The way they treat it is different. So instead of just burning it away, they cut it out and excises it and re-stitch it. Also to make sure that there's no scar tissue, because some of the issues I've seen with scar tissue after endometriosis surgery is worse than the endometriosis itself. Then they also have a focus on preventing that scar tissue through certain techniques and through materials that they use. That's one of the huge ones. That's, there's not that much of a focus on adhesion prevention in endometriosis. So again, I don't want to go into too much medical detail, but the approach is really quite different. And I've just taken one example of endometriosis and the surgical approach to endometriosis in NaPro compared to, normal surgery. But we could do that for, every condition, whether it be medically and surgically. So we've just tried to, I guess, pick up where medicine left things behind. And, they moved on to the artificial stuff. We've tried to pick up from where they left on. Obviously, we don't have as much resources, much less money behind the studies, much less numbers behind the studies and the evidence.
Yep.
But that's what happens when kind of, I guess, big industry and big pharma takes over.
Yeah, fair. Does NaPro treatment kind of end at conception, or
no?
It keeps going through
definitely
through the pregnancy.
Yeah, because again, from our view, some of the same reasons you could be infertile could be the same reasons that you're having recurrent miscarriages or not able to hold a pregnancy.
Yeah.
There's a focus on pregnancy support in NaPro technology, definitely.
Awesome. Yeah. So, because I know you mentioned that you want to get basically, in my own wording, like the body right, not just for one pregnancy, but for future pregnancies as well. But that would continue even through the pregnancy. Through the
pregnancy, even after the pregnancy, start working again on, optimizing your health as much as possible. But even certain conditions like postnatal depression, there's research in NaPro technology of treating that hormonally and having really good success. So we've made a lot of, breakthroughs in the NaPro technology research on certain things.
Wow.
Yeah.
Okay. So at what point, and I'm sticking to women here for the moment, but at what point should a woman consider going to a NaPro doctor rather than just a general kind of GP or something like that? Like, does that make sense?
It does.
Okay, cool.
Yeah, I would say that, if a woman at any stage feels that, her symptoms aren't being treated appropriately and no one's getting down to the kind of core of it, and they're giving certain medical treatments that are just there to kind of control symptoms or to mask symptoms, really, we could be helpful, from the very, very start. You don't only have to be married or trying to have a baby to, benefit from the NaPro approach. In fact, I regularly encourage engaged couples to start, if they know they have a medical condition like PCOS or something else that can impact your fertility when you are married, the earlier you start, getting on top of it, the better. That way, when you do get married, you're good to go,
Yeah.
We don't have to spend, time stuffing around and doing all the medical treatments.
Yeah. Fair. Wow, okay. That's good to know. And it's interesting to hear because in my mind, the whole end goal of the NaPro treatment was for the conception of a child. But this is, and you've mentioned it already throughout the whole podcast, but still in my mind, it was kind of just that. But more so, again, it's that holistic approach to the person. Yeah. And the conception, again, is obviously a benefit.
And the fertility is a happy side effect, I guess.
Yeah, that's right. That's right. Okay, cool. Well, that's pretty good to understand and to know. I hope I'm not, moving on too quickly. I hope I haven't missed anything on the female side of things.
Oh, there's a lot.
Yeah.
But yeah, I think that's just as a bit of an overview. That's fine. Yeah.
Awesome. And then I'll throw it back to you now for the men and those sort of conditions, what they are and how you go about treating those.
So Men, I find, is probably a lot more lifestyle than women, but there are certain medical conditions. Anything really that can be a physical obstruction, so, trauma, past infections, I see men who've had STIs in the past, things like that. They can all impact like the passage of sperm through, any part of the process. So, from the scrotum up to the epididymis, which sits on top of the scrotum, through the vas deferens up, around the back of the prostate and the bladder, and then through the urethra, which is, your urinary passage. So there's a lot of like physical issues along the way that can lead to them. One of the more common ones we see is problems like on around the testes, so whether it be like varicocele or larger epididymal cysts and things like that. So there's certain treatments that can help with that. But I guess in terms of other things, it would be, hypogonadism, so low testosterone levels, and a lot of different factors that can affect that. Some men might just have, background inflammatory or autoimmune conditions, and that's led them into what we call like a more pro-inflammatory state, and that can impact their sperm quality and their sperm health. So one of the most common things we see with men is that they have reduced sperm parameters. So, the sperm count could be low, the motility could be low, or the morphology could be low. So that essentially means the sperm count is concentration of sperm. Motility is how well they're moving, and morphology is, abnormal sperm. And so, say just taking morphology as an example, we say, a good number of sperm morphologies to have 5 to 10% of your sperm appearing normal under a microscope. So it's a relatively low percentage that need to be normal to have, good fertility. And so, if your morphology is 5%, or usually lower than 5%, then, there's a lot of things we can do to help improve that and instigate treatment. Again, like I mentioned, the lifestyle changes, we always start off with that. Adding supplements. So our supplements for men are focused on, high dose antioxidants, vitamin C, vitamin E, which we know are very good for oxidative stress, and, some other things as well. Yep. I find that working with men can require a little bit more patience than women. So, for a woman, you might instigate a treatment and in the next cycle how it's going to, how it's helped or how it's going to. But spermatogenesis and the maturation of sperm for men, so the creation and maturation of sperm, is a process that takes about 3 months. So similar to how we say, your red blood cells renew every 3 months in your body. So, usually you have to start a treatment, and, you can check in on the sperm analysis, 3 or 4 months later. And we already went through like some of the difficulties with doing sperm analysis. So sometimes that's not always realistic to do it every 3 or 4 months, every single treatment you instigate. So it can require a little bit more patience and time to know if, treatment is working. But we go into, certain, medications and things that can help improve sperm parameters as well. So there's a lot.
And the like, to be able to identify that, is that same method of testing that we were talking about before?
Yes. Yeah, specifically on the semen analysis. Yeah.
Wow. Okay.
Yeah.
So you can tell, like, sorry, I forgot the terms, but you were saying like the concentration, the
motility, morphology, and there's other things we can look for, like your DNA fragmentation. How early your sperm is being broken down, or at a higher rate than usual, things like that.
Wow.
We look for immune markers in the sperm, antibodies and things like that as well. Yeah.
Crazy.
Yeah. But sometimes we don't always need to do that.
Yeah.
And what I mean by that is, sometimes, it's a bit difficult to be doing a sperm sample, like I said, every 3 or 4 months or so.
Yeah.
But even if a sperm sample can sometimes semen analysis be normal, it's just part of the process of optimizing everything we can behind natural conception, that you'd still want to work with a male if you identify certain lifestyle factors, because that could be impacting the DNA quality of the sperm, and that's not going to show up on a semen analysis. So if you know that a male has hormone problems, or some sort of autoimmune condition, or thyroid dysfunction, or whatever it might be, an inflammatory disorder, you want to help and make them healthier generally, because you know that that's going to improve their sperm quality overall.
Wow. Okay.
Yeah.
That's amazing. So it sounds like, I mean, you mentioned as well that it's more of a lifestyle sort of approach. I don't know, when it comes to men, which makes sense because that was a lot like maybe less to take in than than the women's side of things. Do they like? Do you find that more of when it comes to infertility and things, that more of the issues come from either men or women, or is it just a mix? Like it really just depends.
It's about equal.
Oh wow.
Yeah.
Okay.
So about 40% male factor, which is male issues.
Yeah.
40% female factor, and then about 10 to 15% combined. So issues both sides. And then, so these are in traditional studies, so they leave, 5 to 10% of unexplained fertility. But for us, if you dig deep enough, you're always going to have a reason or a cause.
Wow.
Yeah.
That's, even from I understand why you had no questions on the women's perspective, because it's just, that's a whole lot of detail that I had no idea went into this stuff. Like in my mind, it was, you get married, you consummate your marriage, and then, whatever. If you're lucky, you're lucky. If you're not, you're not. Yeah. And that's it. I like that. So obviously,
and the numbers are with you from that point of view.
Oh,
like 94% of couples will usually be pregnant within 2 years.
Wow.
Yeah.
Wow.
And again, in the traditional research and numbers, you could say because I think it's 80 to 90% would be pregnant within a year, they start looking into infertility after about a year and start, doing tests and investigations, although not as deep as we like to go. In our approach, because usually we have women tracking their cycle and we know exactly when they're ovulating and they're able to better time intercourse, we know that if you're not pregnant through timed intercourse, not random acts of intercourse, if you're not pregnant through timed intercourse within the first 6 months, we know there's some sort of issue, and we start digging in pretty early after 6 months.
Wow. Okay. Yeah. Oof. Thank you. Thank you for going into that. I don't want to skip over anything. Like, there might be some things that maybe you haven't mentioned that you're hoping to mention. But I was going to ask some more kind of like personal, not like personal, like about professional questions, but about you in particular, like where you went. Is there anything that we kind of missed that you were hoping to go over in particular in terms of like that medical side?
It's hard to get into a lot more detail. Like I said, it's a very tailored approach. So, getting into more detail really requires, having a patient in front of you and going into, deep history and deep dive and investigating and dealing with, factors one by one as they come up. But as an overview, I think that's kind of it's enough for the, it's enough information for, most people to know to get started.
Yeah, cool.
Yeah.
Cool. For sure. I will vouch for that.
Maybe come to think of it, like some of the details in the NFP methods might be worth going into a little bit.
Yeah.
Because the NFP methods are, so these days we're moving away from calling it natural family planning, because maybe that's built up a bit of a negative connotation in wider society over time, and they're more called fertility awareness methods. But they're a big part of what we do and a big starting point in what we do. So I think I already mentioned a little bit about how we track, certain biomarkers. So that could be, some methods look at basal body temperature. Some methods focus on cervical mucus. Some of them, the more accurate one that NaPro technology is built on is called the Creighton model, which focuses on cervical mucus. And, this field isn't really recognized, outside of NaPro technology or talked about much. I shouldn't say just NaPro technology, but the restorative reproductive medicine field. It's not really talked about much. And so, for example, as a doctor, went through university, went through, years of hospital work, and then I was starting like GP specialist training when I got married in 2019. I didn't really know that women had cervical mucus discharge. Okay, that might be expected of like a layperson not to know, but as a doctor, having never studied that, when I learnt that, it kind of blew my mind. You know, and knowing about, you know, how important that cervical mucus is for fertility as well, which is not really recognized or, you know, studied into or talked about much in, I guess, the general gynecological field. So some of the discoveries from that point of view in NaPro technology is essentially, we know that it's primary, its main function is to transport sperm and to nourish sperm and essentially allow it to live longer. So we say that sperm only lives about, you know, up to an hour in the vagina because it's quite a acidic, hostile environment. So you need good cervical mucus around the time of fertility to transport sperm up through the cervix into the uterus. And then looking at this cervical mucus under a microscope, you can actually see, certain properties of it that help with sperm transport. So you see channels the sperm can swim through. You can also see what we call like this ferning pattern. It looks like a fern, but it's a little bit of a maze. And the function of that is to filter abnormal sperm. So there's a lot of like this amazing design built in. It really shows God's design in the body.
Yeah, wow.
And so we know that, you know, in that phase of your cycle leading up to ovulation, when you're releasing estrogen, you release a different type of mucus, and it's this fertile type of mucus. And this is really, really important for fertility. And then after you've ovulated, when you're producing progesterone, the type of mucus changes and it becomes a bit more obstructive, like a mesh. And so this is a natural way that you wouldn't fall pregnant after ovulation. So, you know, we go into a lot of detail into cervical mucus and the qualities of it and how we can help if, you know, women don't have appropriate or they have too much, or, you know, there's issues. Like I mentioned, the different hormones that go into different types of mucus, we can know that there's a hormonal issue in the background if we just, you know, try and look into the cervical mucus a little bit deeper. So it's another big part of what we do that wouldn't normally be done in traditional medicine at all.
Wow. Why are they missing out on that stuff? Like, is it that... See, this is what I thought when you were talking, but again, this could just be the ignorance and like me just hearing this for the first time, and I'm a little bit more critical of secular society than...
Yeah. But don't forget, I heard it for the first time as well, only when I did the NaPro training. Like, going through the whole medical system, I had no idea.
Yeah,
that's crazy.
That's wild. Yeah, that's actually wild.
Crazy.
Yeah.
But see, is that like this is what came up in my head, right? I'm just going to sound stupid and say what was in my head when you were saying that. But I was thinking like it is something that was intentionally designed by God.
Yes.
And so is it just ignored or missed or whatever because maybe I don't know, but is it because like a secular doctor, for example, would see something and just think, well, like, I don't know, like is something just coincidental to them and they just think, well, maybe that's just something that doesn't matter. Whereas someone who knows that this is a particular design by God
Everything
means that it
function.
should, it should, there's a purpose or a function behind it.
Yeah.
I don't know. Does that sound stupid or like why is it missed out? I don't understand. Yeah, I just don't understand how they could just skip over that almost.
Yeah.
That's incredible.
Yeah, I couldn't really answer that for you.
Yeah, that's all right. No, I mean, I guess that would just be left to hypothetical, almost like hypothetical scenarios that would lead to that. But that's oh my goodness, the intricacy of like, I don't know.
Yeah,
it's just
beautiful.
amazing.
It's mind blowing.
Yeah, my goodness. Are you because you said you were mind blown when you found out about that particular thing, but like when you got into medicine, and again, this is kind of a more generic sort of question, but just out of curiosity, before you even got into medicine, were you aware of like how detailed the human body is? Even if you weren't aware of all of the details, were you aware that it was so detailed? Does that make sense?
No, probably not as detailed as I've come to find.
Yeah.
Yeah, and as intricate, as interconnected. Yeah.
That's amazing. Oh my goodness. Oh, anyway, thank you for sharing that, because
It's okay.
that's that's awesome to learn about. And to be honest with you, there are like there are certain times in certain podcasts where I think if I was listening to this on YouTube or whatever, I would pause it here and like rewind and then listen to it again and then pause and just stop and think about what was just said. And like, I mean, there's been a lot of that today, but particularly this is like something I would just pause and go. I would rewind first, listen back and listen back and listen back, and then go, this is crazy. I need to actually like learn more about this. And then, and go and do some research or something. Cause really that's incredible. Thanks for mentioning that.
Yeah. I think that's a big part of why I felt that, I felt a push to go into this, and to move into opening a clinic kind of centered around this, because it's not found anywhere else. I tried to do this type of work at a GP clinic. It was very difficult, spending an hour with a couple. You've got a waiting room, with 8-10 people sitting there. It really needs to be kind of its own dedicated field. And, because of all the intricacies that go with it, I felt that's why I kind of needed to separate it into a different clinic. And,
awesome.
Yeah.
Well, why the I kind of asked this at the start, but like, why the particular interest here? Is it just something that sparked like an interest in your mind, or is it a passion for life, for example? Like,
it's a bit of a journey, actually. So I think I first heard about NaPro technology around the time of my conversion into the faith. So I obviously grew up Maronite Catholic, went to a Christian school, but never, I think like a lot of people that you may have spoken to, never really was taught anything about the faith. Never knew about the real presence or, anything really of any substance about the Catholic faith. My kind of conversion into the faith came in 2008 World Youth Day, and I was in university, and I was studying at the University of Newcastle, but I still had some school friends down in Sydney, and they dragged me along to World Youth Day. And it came at a time in my life where I was really, really struggling as well, because being a Maronite boy, having lived with my mum my whole life and moving up to Newcastle to medicine, I was struggling a little bit, cooking and cleaning for yourself and looking after yourself. But also just going into the whole secular lifestyle of university and drinking, going out, and wasn't doing too well in uni and very close to kind of dropping out and failing. And then at that stage was when a friend dragged me along to World Youth Day and started going, having a bit more interest in the faith and, going to certain talks like Guardians at St. Charbel's and things like that. And I think that's probably where I very first heard about NaPro technology. Would have been from one of the US speakers, most likely Tim Staples, although I can't really remember. But it was mentioned, I remember going and kind of Googling it and looking into, what is this Catholic type of medicine? And I'm like, oh, okay, that's like more into gynecology and stuff. So, it was just, I put it aside for then. And, as I came into my conversion for the faith, I really started to question about, why God had put me in medicine. And, spoke to a lot of amazing spiritual directors who told me to see medicine more as a vocation. What they said to me, and one priest I'm remembering in particular, was, he said that, medicine is one of the only jobs that's very similar to being a priest, in that, it's a day-to-day vocation, and you can see the hand of God working in front of you and healing people, day to day, and you really have to look at it like that. And I think at that stage, again, through the whole medical training, I was falling into this trap of seeing people more as like, a condition or, a patient rather than a whole person. So it really helped refocus me. So I guess NaPro technology was just like this thought or this thing that I'd heard of very early on. And my focus in medicine was, how do I live this out as a vocation? And so we started, that's kind of around the time of 2013 when we started Maronites on Mission at St. Charbel's. So I was one of kind of the co-founders of that with 7 others. We started that with a missionary trip to the Philippines, and that started as a medical and dental mission primarily because we were looking for ways that we could help and use our skills and our vocation to help.
Wow.
And then it kind of went on from that. The international mission has grown, every year since then. The local mission and all the work they do locally has grown since then. But it all came from this view that, medicine to me is more of a vocation of how I can kind of give back to people. And I started looking for ways in which I could live out that vocation, better. So I started doing a little bit of work, volunteering with, so we had Maranatha Mission, we had a food van. And then there was this medical service called Street Side Medics that would come along to the food van and provide medical care to, homeless people and stuff. So I thought, I'm working with Maranatha on Mission and we're providing food, but this is an opportunity for me to actually use my skills.
Yes.
And so I jumped onto Street Side Medics. So I've always been, looking for ways where I could, better give charitably, because that's always been, the best way for me that I've been able to live out my faith, and that's kind of kept me grounded in my faith. And so then, all of that played into the process of me, deciding to move away from hospital work and surgical work, which I was tending towards, because I built up a bit more of a focus on, family, wanting to get married at that time around, 2017, 2018. It was when I decided to go into GP work and GP specialty training because I was getting married in 2019. And I didn't want to, be doing a lot of hospital shifts or overnights and things like that. So I guess then that's when NaPro started coming back into the picture. Because through my GP work, again, I've always been the type of doctor who'd ask and look in behind, questions and things like that. So I couldn't tell you how, but I think just naturally, maybe the area I was in, being close to St. Joseph's Parish, I was seeing a lot of young patients, probably younger demographic than most GPs, and a lot of young couples, and they were struggling, not just with fertility issues, they were struggling just with women's health issues. And I was running an infusion clinic, and so I was seeing a lot of iron infusions, but I wasn't happy just leaving it at doing an iron infusion for someone. I'd say to the woman, do they know why you're bleeding so heavily? Why are you losing so much iron? I want to go into the reason behind it. And so then, again, looking for answers to the questions behind all that was when NaPro came back onto my radar. And after that, probably from about 2020 onwards, was when I thought, I need to do the NaPro training. But from then, it was just waiting until I finished the GP specialist training. And then as soon as I finished in 2023, I went over to the US and started training in NaPro. That's kind of my whole journey over time.
That's beautiful.
Yeah.
That's awesome.
Yeah.
So you're basically like a revert to the faith, I guess, in a sense.
Yeah.
And then it's like it sounds like it was obviously through the faith, but through experiences of like the patients that you were seeing at the time.
Definitely.
That re-sparked that interest, I guess. That's beautiful.
Yeah, and now I look back and I see those whole struggles I went through at uni and almost dropping out, and all the struggles I went through in the hospital work and deciding which specialty, and kind of falling into the GP specialty wasn't necessarily my first choice. But then you just see this is where God wants you to land, really.
Awesome.
Because it all led me, in my view, to this kind of vocation.
Yeah, for sure.
And a big part of that I didn't talk about was my wife, Nadia, and how she's kind of encouraged me through that whole process. And she's so on board with it that she actually, this year, while she was pregnant in July, went and did a practitioner course for the Creighton charting. So I spoke about how women chart their cycles. So she's working with me, working in our clinic, helping women with charting their cycles. So it's become really a bit of a family vocation for us.
That's awesome.
Yeah,
I love that. Is your wife a doctor as
no,
well?
she's a dental background, oral hygienist.
Wow. Yeah. Oh my goodness. So she's taken this up to almost make it like a family business.
Yeah.
I love that. Shout out to Nadia. God bless you.
She's the greatest.
That's awesome. Oh, I love to hear that. That's beautiful. can I ask then, because I'd imagine that a lot of people probably wouldn't naturally think that the same with like science and the faith, or like maths and the faith, things like that. They don't really coexist. So were there sort of key moments in that journey of coming back to the faith and studying medicine now as more of a practicing Catholic? Were there any key moments there that that kind of made you like that affirmed you, or reaffirmed, whichever, that connection between the Catholic faith and medicine?
Yeah, I would say so. I think it was as I was getting into a bit of the pro-life journey, and starting to deal with certain issues like coming across abortions in hospitals, and contraceptives being a big part of a lot of treatment that a lot of women are on, and having objections to that. But I guess that kind of primed me for the NaPro stuff, I would say, because it taught me that modern day and traditional medicine doesn't always have the answers and doesn't always align with what we do. And so that was a bit of a primer for NaPro, I guess, because it's very countercultural in that way. Yeah.
So more to that spiritual side then, have you seen like couples grow in their spiritual life just from the journeys that you've helped them take part in?
Yeah, I think understanding your body and what's going on with your body, and finding answers for these questions that you've struggled with for such a long time, it helps put things into perspective. And it's not just I guess an approach that the woman goes through on her own, or the husband goes through on his own. We very much encourage them to go through this together. So for example, when we're talking about the women charting their cycles, the man gets involved in that process too, to understand his wife and her cycle and her symptoms and what she's having. So from that point of view, it helps them grow closer as a couple. And then through that, it makes it easier to get couples to understand, we spoke about the theology behind marriage and the sexual act and everything that goes into it, if they're more kind of understanding of the biology behind it as well. Yeah.
Sure. That's beautiful. You actually answered my next question in that answer. So that was amazing. Yeah, because it was the spiritual connection, but also the connection between couples. And again, that speaks to that holistic approach. Is like, it's everything. And so that is, that's a powerful thing to hear, because it's like we mentioned earlier, like it takes an emotional toll. It's like it's emotionally taxing, like it would Definitely. Be on the individual, but then also it could potentially cause like strain within the relationship.
Definitely on the marriage itself.
Yeah. So it honestly, like, it really is amazing to hear that every aspect that is affected by this, or every aspect that not is affected, that affects a person, and whatever condition that they might have or whatever, is seriously being looked at and treated in the NaPro approach, or at least in your approach to NaPro, which is amazing. And so you've dedicated your career now and your vocation to the NaPro treatment, and you mentioned hopefully that'll be an exclusive thing. Is that right? Like that's what you want to exclusively focus on. And again, I can't remember if it was on the podcast that we mentioned or before it, but you opened the first like dedicated clinic to NaPro treatment. Yeah. Is that right? In Sydney?
Yeah.
Awesome. Congratulations.
Thank you.
Again.
So it's called NaPro Life Centre. It's in Gordon Park. And I would say that there have been NaPro doctors around and I'm in contact with some of the NaPro doctors that trained 20 years ago, and they've been practicing here in Sydney, but they've been trying to do that model of you're working out of GP clinics and things like that, whereas I wanted something more dedicated to everything that goes into NaPro, and that was not only my vision, but I'd say probably Nadi's vision more so in kind of creating this clinic and this space for our patients.
Wow, God bless you guys. And so for anyone who's looking to get maybe a consultation or something like that, how best can they do that? Should they contact you guys or just walk in? How does it work?
By appointment, because obviously, as we've spoken about, takes a little bit of an assessment.
Yes.
So the best two ways are on our website, naprolifecenter.com.au, or just find NaPro Life Center on Instagram. Yeah.
Awesome. How good. Actually, before we finish up with just like the last kind of question that I get to with every guest,
Yep.
Is there a final message that you'd like to leave our listeners with, maybe regarding NaPro in general, or even just general health, anything like that?
Good question. We've covered a lot.
Yeah.
I guess talking about infertility might seem like a little bit of doom and gloom, but like I think we mentioned it earlier, the numbers are with you.
Yes.
So it's not every couple struggles with these issues, and some couples could even have the medical issues, but they have good fertility, so that can still be managed and still be treated appropriately. But yeah, I guess that's it.
Awesome. Michael, thank you so much. I want to finish before I get you to sign the canvas.
Mm-hmm.
There's a question we ask every guest. Now, we've been so focused on life in this episode, but this particular question has to do with death, in a sense. At least the journey to death. So, do you know the concept of death row last meals?
Yeah.
Okay, cool. So I said that properly this time, and we got it. Okay, so as I always tell our guests, in different states, in different countries, there are different rules regarding the death row last meal. But here on Against the Grain, there are no rules.
Okay.
So you can have whatever you want, how much of it you want,
Okay.
from anywhere, cooked by anyone, whatever you like.
All right.
Okay, so you're on death row, and you get your last meal. What are you getting?
I'm getting my mum's mlukhie, sambusek, tabule, and maybe a nice probably a wagyu rump steak.
Yum.
Yeah.
Yum, that's great. Any drinks?
Sparkling water. I don't. Yeah.
Really? Okay. Sparkling water, sure.
Or a nice Shiraz to go with the wine.
Ooh.
Sorry, to go with the steak,
The steak.
actually. Yeah.
Yeah, nice. I like it. And a sparkling. You can have both.
Yeah.
Lovely.
Probably both.
Nice. Any dessert or anything?
Donuts.
Donuts, perhaps?
Not a big fan of myself, actually.
Oh, you're serious? Well, thank you for bringing them in.
Yeah. Not that much of a dessert guy.
Me neither, to be honest. So I completely understand. Do you get hot chips with your thing? I don't know. Not many people mention hot chips. I didn't mention it when I got asked, to be honest. I forgot. But would you get hot chips with your...
Yeah, with the steak, I'd do some veggies and definitely hot chips.
Nice.
Maybe
Steakhouse chips or...
Yeah.
Fair. I like it. That's good. That's your death row meal?
Yeah, has to be.
Good order.
Nice. That is a good one. I love it. And what I'll do, honestly, I forgot to mention this as well before we started, but I hope I'm not putting you too much on the spot too much, but we have our Against the Grain canvas. Every guest that we have on, we get to sign with your name, signature, and favorite quote or Bible verse or just a message that you want to give, anything like that. So I'll give you the texter once I find it. It should be somewhere on this table.
It's behind the box.
Cool. So I'll pass it to you and I'll grab you the canvas as well. There you go. Whoa. Oh my gosh. Sometimes I forget if my legs work or not. After sitting for so long, wherever you like on the canvas. There's limited room, but luckily we only have 2 more episodes after this.
Oh my gosh, that's
So,
crazy.
I know. Please God, next week we'll have an exciting, like a particularly exciting one for our footy fans. But that's as much as I'll say, because
Just in case.
yeah, just in case it doesn't work out, you know. Thank you so much. So,
That's okay.
do you want to? Oh, that's beautiful. Do you want to read out what you've written there?
It's put on the armor of God from Ephesians 6, one of my favorite verses.
Beautiful. Why is that? Oh, sorry.
Something that's always resonated with me. The idea of kind of being a warrior and having the armor of God, and it talks about, you know, the breastplate of righteousness and the sandals of truth, and, you know, that whole verse. Yeah.
Love it. Thank you so much. Also, sorry, I know I said I'm finishing up, and usually that's the last thing, but I forgot to ask. Are you familiar with the milk grotto?
I've looked into it since Michael was on the podcast, but I didn't know about it before then.
Yeah,
Wow.
that was new to me, but he was saying, he's a NaPro doctor.
Yeah.
Gave it to him or recommended it or something like that.
His friend, the NaPro doctor's friend, had it.
Oh, okay. So he gave it to him. And
Yeah. So Nadia said to me, we have to get some for the clinic.
oh,
Yeah,
beautiful.
That'd be
One day.
beautiful.
How good. Yeah, God bless you guys. That's it was just that was again just a question of curiosity, but amazing. I didn't know about it.
Yeah.
So Michael, thank you so much again for coming on.
No, it's been a pleasure.
Really appreciate it. Pleasure's been all ours. It really has. Thank you for helping me, such an ignorant person, understand it better, and to just know again, like the amount of detail that could go into these things and how much care I should be taking of myself from now. So
It never hurts to look after yourself.
yeah, this is true. It might hurt the ego a little bit, and maybe maybe a bit of the I don't know, the pleasure sort of side of things. You know, maybe not so many sweets, but yeah, no, I really appreciate you coming on, and just to finish off as we always do, remind everyone at home that or wherever you are listening to this podcast, that our life is not our own. We belong to Jesus Christ. So don't be afraid to go against the grain. God bless everyone. Thank you so much.
It's all right. Thank you.
Thank you.